I'm joined by Dr. Were Onyino, the president of the Kenya Medical Association. Dr. Ari, thank you very much for making time.
Thank you for having me.
Okay, we begin at KICC from the National COVID-19 Conference, and I want to get a feel of what you think of the eased restrictions and the measures that the president has announced this evening pertaining to COVID-19 in the country.
Yeah, thank you. I think from the conference at KICC today, I think the president's pronouncements are welcome. I think they are timely, and we agree with most of the measures which we had advised on, even in our presser that we did yesterday, in terms of a gradual opening of the country. And we like the fact that he emphasized that we still have to take personal responsibility in terms of observing the public health measures so that we can get our pandemic started.
The main aim of the conference today from the president's opening speech was to take stock of how far we've come in our fight against COVID-19. And I want to get it from you, from where you stand. What are some of we can begin with the hits. What are some of the hits that we've heard in our fight against the COVID-19 pandemic?
I think it's something that we've never handled as a country before. And I think the movement in terms of what we saw from the national government in terms of preparedness, it's something that we quickly had to learn. We had to train a lot of the county government officials, national officials, and healthcare workers in both tiers of government. And I think one of the major challenges and the hits that we faced was the issue of testing.
Dr. Onyino? Okay. Good. Now, how about the misses? Because the pandemic came with its challenges. You've said it's a novel virus that has never been experienced anywhere in the world. Where would you say we went wrong in our handling of the pandemic?
I think an opportunity that we missed was actually in terms of testing. We were not able to have the local capacity to actually respond to the needs of testing that we needed to actually help us better respond. The issues of the healthcare workers' protection is another miss that we had. And unfortunately, we lost more than 16 healthcare workers that we know of. And I think the other miss that I think we have as a country is now on issues regarding accountability of the funds that are allocated to mitigate this COVID pandemic.
Dr. Ari, I want to pick up a point you've raised on the welfare of the medical personnel that are frontline workers in the fight against COVID-19. So far, unfortunately, we've lost 16. But when you listened to the panelists during the COVID-19 conference, they sounded very optimistic. They said we have enough PPE. In fact, we've begun exporting to the region. Paint a visual picture for us, you who's in that sector. What's the plight and welfare of doctors looking like at this time?
I think the issues of PPEs to date remain unaddressed, especially supply of quality PPEs to healthcare workers has still been a challenge. It continues to be a challenge, and also on the issues of the welfare of healthcare workers in terms, we are well aware that you're having a string of strikes all over the counties because of non-payment of salaries for the last 3 months. So the healthcare workers have put their best foot forward in terms of helping the country handle this pandemic. I think we did not take care of the healthcare workers and appreciate them well for the good work that they have done. And what you can see, that the country was actually spared from the worst effects of the pandemic because of the good work by healthcare workers. So the issues of the PPEs are still a challenge. And we think we need to continue to address it, even as we increase our local manufacturing capacity.
Okay. Finally, Dr. Ari, as we finish under 30 seconds, talk has been rife that we are flattening our COVID-19 curve because the numbers have been dropping every single day. With this in mind, where do we go from here with regards to keeping our numbers low and avoiding a second wave of infection?
I cannot say that we've been flattening our count because we've not been adequately testing. We've only been reporting the numbers from the positive cases.
Dr. Onyino?
To actually accurately, we need more data to actually accurately inform that decision that we have actually flattened the curve. So I do not agree that you're flattening the curve. We need to do more testing so before we reach there. So I think moving forward as a country, we need to continue adhering to the public health measures and ensure that
great challenges of technology, but Dr. Onyino, they're making a very great point on the need for mass testing as we continue to ease restrictions and probably move to a full reopening of the economy. Dr. Onyino, thank you for making time. That's where we leave it.